Hi, I'm Felicity, a registered nurse, cosmetic injector and founder of the Fit Injector Clinic. Welcome to my channel and video podcast streaming on YouTube, Spotify and Apple. Today is episode 23 and I have Kelly joining me today. Welcome, Kelly.
Hi, thanks for having me.
Thank you so much for coming and having a chat. I really appreciate it.
No, thank you.
So Kelly, you are a nurse practitioner, owner of your own cosmetic clinic, KB Aesthetix with an X, in Brisbane, a clinical educator and mentor with over 14 years experience as an aesthetic nurse and over 20 years of nursing experience. Wow. I'm feeling pretty privileged to sit down and have a chat with you.
That makes me feel so old.
Well, you don't look it.
Botox.
Thanks. You have kindly jumped straight off your flight into Sydney and into my clinic. You're going to be in Sydney this week and doing some training and you've come straight in to film this episode. So thank you so much.
No worries. I'm excited to be here.
So good. So I followed you on Instagram for ages and had the pleasure of meeting you a few years ago in person at a KGA conference when you spoke.
Yeah.
Really interesting presentation that day. And recently got the opportunity to learn and get hands-on with you at an advanced injector workshop, which was just fabulous. That was only a few weeks ago.
Yeah.
And you've also been training up my new nurse who I've got in my clinic at a recent boot camp, which she absolutely loved.
Great.
So today we're going to chat about you being a nurse practitioner in the cosmetic industry, your clinical educator role and prescribing services available for independent nurse injectors in Australia.
Lots to talk about, hey?
So much. So let's start with a really popular question from our followers and our listeners is how you became a cosmetic injector.
Well, I guess it's a little bit of a long story, I suppose, and I think I sort of ended up here a little bit by accident. So I studied nursing many years ago and left Australia to go and work in the UK. And was working in Scotland. I then decided I was going to move to London. So I said to a friend of mine, do you know anyone who needs a nurse? Because I'd been working in emergency and a medical day case. And she knew a plastic surgeon who needed a nurse. So they flew me to London. I had an interview. They gave me a job as their clinic, the plastics nurse in theatres there. So I started working in Harley Street, doing plastic surgery, assisting in theatres, helping out with their tox and their fillers. So it gave me a really good insight into the industry.
Absolutely.
So that was really interesting. It was back in the day before nurse injectors really. So this is like 2003 or 2004, I think.
It wasn't cool. It wasn't popular.
No, it wasn't. Yeah. There wasn't I don't think nurses were really allowed to inject back then. It wasn't really considered within our scope. Yeah. So my two plastic surgeons used to inject and so I got Botox for the first time. I got my lips done for the first time, even though the boys were like, Kelly, you don't need Botox, but I just wanted it. Yeah. I was 23. I wanted to experience
I need to try this.
Yeah, exactly. And we used to do really interesting things like nowadays we have microdermabrasion. We used to do dermabrasion, which was a brutal procedure under a general anesthetic, and we would basically like sandpaper off their skin, so usually perioral around the mouth, those upper mouth lines, and it was literally a metal device that would just scour off that top layer of skin. It was very bloody and there was a lot of downtime and probably a lot of scarring really, but really interesting sort of the beginnings of microdermabrasion was quite a brutal treatment.
Well, I had no idea.
Yeah, and then other treatments we did was like penis enlargements and different things. So it was quite an interesting role. Stuff. Yeah, it was very different.
From toxins to penis enlargements.
Exactly. It was so vast. We had another treatment called isologen, which was kind of like the precursor to PRP, where we'd take a little sample of skin and send it away to a lab, and they would create some skin cells, some stem cells that we would get back 2 weeks later, and we would then inject it into the patient.
Amazing.
Much in the way of PRP. Yeah. So I was very blessed to see some really interesting things and do some interesting things. Then I came back to Australia 5 years after I left, and I worked rural and remote for a while, and I discovered the AACDS course of the postgrad dip in cosmetic nursing. Yeah. So I did that back in 2009, and eventually when I moved to Brisbane, I got back into cosmetic alongside my ED role. And I just started doing a couple of days a week with a plastic surgeon in Brisbane, and eventually I went to 3 days a week doing that, 3 days a week in ED, so I was working a lot. And from there, I went to a couple of different clinics. Eventually, I decided I was ready to do my nurse practitioner. I'd done a few other courses along the way. So I did my nurse practitioner, and once I finished that, I felt ready to open my own clinic.
Amazing.
So I really enjoyed working in bigger clinics, doing skin as well, and working with doctors and people more experienced than me that were able to mentor me, and I was able to grow my knowledge and experience. So I sort of took the slow route compared to what a lot of people do nowadays.
Yeah, like a 2-day course and
yeah.
turn on the open sign.
Yeah, I never did the 2-day course thing. I did a postgrad dip.
Yeah,
so
this is a fascinating but long journey.
Yeah, it was. It was a very long journey to get to having my own clinic. And I feel very happy that I took that long route. Like I said, it took me almost 10 years before I opened my own clinic. And I'm glad I did, because I understood the industry. I understood how to treat cosmetic clients as opposed to emergency clients. You know, I've been working with emergency patients for years and years and years, and, you know, they're very easy to, after 10 years of emergency, it's easy to deal with them. But
when she says emergency is easy.
Yeah, it's all about perspective, right?
Totally.
But cosmetic patients, they're very different. There's a very different amount of hand holding. There's a lot that goes into the journey of cosmetic medicine and the anxiety of the patients, particularly if you choose to practice independently.
Yeah.
Without a support network.
Yeah.
You're
everything.
You're everything.
Yeah.
You're out of hospital.
In that 10 years, you also got that experience of like learning from others on how to run businesses, and I guess things that you did and didn't want to do in your own business too.
Yeah, exactly. So while I didn't have a lot of input into the behind-the-scenes accounting side of business, but I understood about bookings, I understood about aftercare, patient follow-up, after-hours emergencies. I was involved in dealing with some of those, and just about the cosmetic consumer.
Yeah.
Because I don't think we understand that.
Like unhappy patients, I'm sure.
Yes.
Yeah.
Yeah. What is it that's going to make people come and see you in particular? So little things like that. And I am the type of person that I like to learn everything that I can about everything. So I learned a lot about skin. I got my laser license. I learned as much as I could. I was constantly in with one of my doctors saying, what would you do with this? What would you do with that? Share your knowledge with me. And I would get knowledge from our other nurses or our dermals or whoever, just to learn as much as I could.
Totally.
So education is another passion of mine. So that's another sort of path to my story.
Yeah.
I worked a bit in rural and remote health, worked in WA in the Kimberleys. I worked in Northern Territory in remote settings, and I did a grad cert in remote health as well. So when I moved to Brisbane, I did a bit of education with a company called CRANA, Council for Remote Area Nurses Australia. They provide education to rural and remote nurses. So I started my education field doing rural and remote. I would fly around Australia and deliver advanced life support, pediatric life support, and remote health. And I found that I loved education. I loved teaching. And so when I was in emergency, I naturally gravitated towards the education role there as well. And I loved being able to share my knowledge and gain knowledge from other people. So I think naturally over the years, I sort of drifted into an education role in aesthetics.
Yeah.
So absolutely. I started with Face Academy, which is was a Brisbane-based education company for aesthetics. They are now called ENQUIRIES.
Yeah.
And nowadays I train for Hugel Aesthetics. I train with a company called HealthCert that predominantly do a lot of GP education. They have a professional certificate in aesthetic medicine.
And that's what you're here for this weekend?
Yeah. So we've got a 2-day course that I'm helping to facilitate that for this weekend. I also do some private training. So I do one-on-one mentoring because I found that there's a big gap in the education that is out there. A lot of the education that we get is pharma training, and it is inherently biased, But it is also limited because it often ends up being area specific or treatment specific rather than holistic global full face assessment.
Definitely.
There's not a lot of time to do anatomy, and there's not a lot of time to do facial assessment and truly treat the patient the way they should be treated, whereas you might come in for a cheek session or a temple session, and that's not necessarily what's best for the patient. So,
yeah, but it's like, well, this is what we need to cover this day for this injector. Yeah.
Yeah,
so
this is what I want to learn, so teach me. So from that, I decided to offer one-on-one mentoring and being able to do a little bit more of a tailored approach.
Fantastic. And I did see that on your website. So is that where nurses would reach out to you directly and you provide that?
Yeah. So the way it works is they would reach out to me. Generally, I prefer to do it with people who have a little bit of experience already rather than true beginners. And then we can create a tailored mentoring day to suit their level of education, the products they want to use, the areas they want to upskill in. And then we get time to do anatomy, we get time to do full face assessment, we get time to do some aftercare, and then we touch on a lot of the business side of things.
That's great. That's a lot of value.
Yeah, because that's missing as well, because people are setting up their own clinic and they don't know about CRMs, they don't know about booking how to work out booking systems, aftercare, having a second phone number, all of the things that go with running a business that you never knew about as a registered nurse in the hospital.
Yeah. We're not business owners when you go to university and study to be a nurse.
Yeah. And you obviously know a lot about business. It's challenging and it's not innate for us to know, right?
Yeah. And I feel like you're always learning, like obviously with our clinical skills, but then also with our business skills, like we were talking about off camera, you know, especially me stepping into this role with a bigger clinic and a bigger team. The biggest shock for me was like, oh, I'm a boss now and I actually have to lead a team. And so going away and learning how to do that better.
Yeah, and deciding what kind of manager do you want to be?
Yeah.
How do you want to foster your team and how do you want to grow that?
Yeah.
And maybe even giving away a little bit of control, because I think when you've been a solo injector and you've grown this amazing brand, to then give away a little bit of the control bit by bit is going to be challenging.
It's hard. And even those first few months, it was kind of like, no, I'll just do everything. It's okay. No one else do anything. It's like, well, why have I got a team if I'm still going to do everything? So it's just, having to let go and be like, I'm okay with this and clear my head a bit is actually quite refreshing now.
Yeah.
But it is hard to give away that control. So
definitely.
I love that you cover those business aspects as well.
Yeah. Well, to my limited knowledge, obviously. So
well, I feel like there's a lot after what you just told us. Don't discount that. So my next question was, when did you start your own cosmetic clinic? But we've obviously covered that. So let's get into you being a nurse practitioner. So you talked about when you started. Can you tell us some of the benefits and or challenges of being a nurse practitioner in the cosmetic industry?
Yeah, I think these days it's probably unlikely that any purely cosmetic nurses will get endorsed as a nurse practitioner.
I wanted to ask you that question specifically.
And to be honest, I do think I agree with APRA's standpoint on that, because being a nurse practitioner, and I did my nurse practitioner partly in emergency nursing and partly in cosmetics. So I did all of my assignments at 50-50 and I still practice in primary healthcare, urgent care, which allows me to fulfill the more clinical role of a nurse practitioner. Yeah. So the nurse practitioner role has sort of 4 standards of care that we need to fulfill, and they involve safe prescribing of medication, using diagnostic tools, so investigations, be it blood work or x-rays, ultrasound, interpreting those, formulating diagnosis, and then formulating treatment plans, which we don't really do in aesthetics. We do treatments based off a skill set. And while we talk about doing advanced treatments, it's not necessarily advanced clinical practice in the true sense of the medical word for it. So I do actually agree with APRA's standpoint. That being said, I think that there is a way that you can combine a lot of that stuff in aesthetic medicine. So I do a lot of education. That's one of the pillars of being a nurse practitioner. Being in education and in mentoring and contributing to furthering of the career of the nurse practitioners and registered nurses. So I do a lot of that, which is one of the reasons why I am so active in education and supporting other nurses. Plus, I do a bit of complication stuff. I think just because I've been around for a little while, people know me, they reach out to me for help with certain things, and then more and more people reach out to me. So I do get people asking for help with complications.
Like at the time that they're happening?
Yeah. And then general just advice on, I had a patient with this, and then we'll talk through and problem solve what it could be, and potential for, medication management in that scenario might not be what they were thinking it would be. Because I think when you've been a registered nurse in this field for a long time, you have a bit of an idea of how we're going to treat things. But antibiotics are specific to the infection. So with biofilm, there's a certain type of antibiotic we might use. We used to use a lot of steroids in all forms of medicine, but particularly aesthetic medicine. I know when I was at one clinic, we used to hand out prednisolone, like Tic Tacs. Anyone who got their lips done got some steroid, right?
Yeah, absolutely.
Yeah, but nowadays we have steroid stewardship. So we're actually limiting the use of steroids across the board. So knowing that that's what's going on in medicine and safe prescribing is really important. So there's a lot of things that we can do as nurse practitioners to act in that more advanced space.
Yeah, absolutely.
Yeah. And like I said, I do keep my hand in. I do primary healthcare once a fortnight, purely for my own knowledge, my education, and just to keep my mind ticking along. I like learning. I like knowing stuff. I have to be learning stuff all the time.
Yeah, I can tell. And I was going to ask, because I saw a selfie you took on Instagram the other day on your stories. I was like, in my other clinical role. So I wanted to ask you more about that, and whether that's something that you do because you want to, or something because it's a requirement for you being a nurse practitioner in the cosmetic space.
Yeah, I think it's at the moment for me, it's more of a personal choice.
Yeah.
Like I said, I enjoy it. I have done almost 20 years in ED, a little bit alongside my cosmetic stuff. So I don't want to lose that knowledge.
Yeah.
It took me a long time to build that knowledge. So I use the emergency stuff in a little bit of a different way in primary healthcare.
Yeah.
Which is similar but very different, I'm coming to learn. So primary healthcare being like a GP type clinic with an urgent care attached to it. And it's been a challenge, actually. I thought that I knew a lot about emergency stuff, but the primary healthcare side is a lot more challenging. You're very time limited. You can't order a bunch of investigations and just get your answers straight away because you've got a 20-minute appointment and they're an outpatient. So it's a very different thought pattern. It's a very different environment. So I do it for my own knowledge, and I'm really enjoying learning again at a higher level. But I don't know where APRA's going to go. So
especially we're about to have a new hand down of regulations, aren't we? So
and so I think my mind is not putting all my eggs in one basket, spreading the clinical load and keeping upskilled with everything that's relevant.
Because in those last sort of few update, or the pending things that they were saying would be that probably, as you said before, nurse practitioners solely in the cosmetic space is probably not something we'll see moving forward. So, whether they would sort of say, yes, you have to have both roles to be able to keep it for your cosmetic role. That will be interesting to see if that comes.
And I think a lot of the existing cosmetic nurse practitioners are diversifying. We probably all have done a bit of women's health and a bit of dermatology with what we do, but we're probably, certainly a lot of the ones I talk to, are formalising it a little bit more to make sure that we fully fulfil our nurse practitioner roles and responsibilities. So never say never that there won't be more cosmetic nurses, but at the moment I think it's probably not the space to be thinking that you're going to get into it.
Yeah, exactly. Yeah. Especially people now going, I'm going to do this.
Yeah.
Eliminate the need for doctor scripts.
Exactly. And, I think I hear that a lot. I want to be a nurse practitioner because I don't want to pay for a doctor script. But they're not just paying for a doctor script. They're paying for medical oversight. They're paying for medical knowledge to ideally accurately assess your patient through a thorough consultation process and make sure they're suitable. And I think that we diminish the importance of that role sometimes to just being a formality to sign a form, but
ticking the box, doing the call.
Yeah.
But in terms of, buying our S4 medications and the storage and all the compliance things around that, when there are regulation changes, if you are with, I guess, like a prescribing company, they'll just kind of make those changes, in their paperwork and things like that for you, which is, it is really helpful.
Yeah.
And that, after hours support, if you're, in a situation that you've never been in before with a patient where they're having a complication, you can have that support as well.
Exactly. Because, if your patient needs to be prescribed some medication, they're the ones that are going to do it, and they're the ones that are going to help get investigations if they're required. So there is a medical burden there. But the scripting process is very interesting.
Yeah.
I'll say that.
Which we'll talk more on in a minute. Which takes us into, navigating the regulation changes. Obviously, our industry has had a lot particularly in the last 12 months, and we've got more to come very soon. So have you had to make any adjustments to your practice as a nurse practitioner with these regulations that would be different to, say, anything that I had to make?
I can't really think of any as a nurse practitioner that I have had to change. I think that being a nurse practitioner offers me a little bit of more protection perhaps than a registered nurse. I think the changes are going to come through thick and fast for registered nurses and enrolled nurses in this space.
Yep.
And I will have to abide by those as well. It's just from the prescribing side and medical oversight, I have a little bit more protection there, I guess, because we don't know where they're going to go with medical oversight. There's thoughts that maybe they're going to talk about having a medical oversight in-house, which I don't think will happen. Yeah, but I think a certain radius is reasonable. Yeah. I think setting the fact that your medical personnel should be physically within a radius of your clinic to assist in the event of, adverse events is a reasonable thing.
Absolutely. I completely agree.
Yeah.
You don't want to be prescribing with someone who's like overseas or something. You're like, well, this isn't going to help if I need a second pair of hands.
Yep. Yeah. That's totally. Exactly it.
Yeah. Okay.
And I think the only other thing I would say is that being a nurse practitioner, having done my master's and being a lot more focused on policy, procedure, legislation, I feel like I'm very much abreast of everything that's going on, whereas some of the nurses working in this space are just completely unaware of what's going on and perhaps aren't keeping themselves abreast personally because they're relying on their prescribing platforms to notify them when it's our responsibility to go to the website and read the APRA guideline ourselves, read what the TGA says, make sure we personally understand it and not just rely on somebody else to tell us what it is.
And all those kind of like secondhand conversations
Chinese
that
whispers
were happening at the time. And then when you do see, people and what they're posting on Instagram, you think, have they not read it or do they just not care? And it is hard when you're sort of trying to do the right thing and you see other people, like you would have seen it even in the last few weeks, are they just going, oh, whatever, and just start, putting up this stuff again. And you think, a patient's going to be thinking like, okay, well, they do that procedure, but I don't do that procedure. I don't know. Yeah. We'll see.
It's challenging times and it's really challenging to see things being done incorrectly or blatantly ignoring the rules and not to say anything and just, keep yourself to yourself.
Keep scrolling.
And even when you see people that you had a lot of respect for blatantly ignoring the guidelines in various forms, like that's really challenging.
Yeah. And then you start to think, has there been an update that I didn't know about? Or They're very interesting times.
Very.
So we've talked about your other role, which was my next question. Moving on to clinical educator. So we've obviously touched on this a little bit, but tell us a little bit more about your current clinical roles and what this involves. I've seen it does involve a lot of planes, a lot of airport trips.
Yeah, it feels like that, yeah. So these days I like to do kind of 2 days a week education and 3 days a week in clinic. Yep. Sometimes it swings the other way depending what's going on and who's requested training. But yeah, and sometimes it is interstate, which I don't mind, but sometimes it gets a bit exhausting, travel. I think travel always looks a bit more glamorous than what it is. It's, 4 a.m. flights or getting up at 4 a.m. and different things like that and getting home. I like to sleep in my own bed, so I'll often do a day return, and those are huge days. But yeah, so I do a lot with Hugel, tox and filler training, and we do that around Queensland, occasionally interstate. So generally upskilling people that have already been injecting. I do some beginner boot camps a couple of times through the year with that, and that's where we did one recently with Emma.
Yeah, and then I think it was only a few weeks later that I got to do the advanced one with you, which is great.
I was back down again. Yeah, so that was really good. So I love teaching beginners. I like to I feel like I can set people up with a really good solid foundation in anatomy and understanding on how to assess the face and have an individual approach, because the beginner boot camps are generally 3 days, so it gives us that little bit extra. It's certainly not a thorough starting point, but it gives you an insight into the industry. It gives you a little taste, and then you would hopefully go and build on that. Yeah. So I find that really interesting because people are fresh and excited, and I feel like I can make the industry a little bit safer by instilling some good values in people.
Emma was coming in because she just lives nearby, and so she was coming in every day after she finished with you, and just like a grin from ear to ear. And she's like, oh my gosh, I got to do this and I got to do this and things that she wasn't even sort of expecting she would get to do. Yeah. Absolutely loved it.
Good. Yeah. Well, that's the best feedback. And then to hear that somebody has gone on to be successful in their career and be a good injector and a safe injector, and that's really, that's what kind of makes me want to do it more and more. And I do a little bit of more advanced stuff, mentoring. I like it when I have the opportunity to do the one-on-one stuff because, like I said before, we can then plan a day around what you really need, and we have time to talk about that business side of things, and so that people have a realistic understanding of what they're getting into. Because I think, as you probably get yourself, we all get a lot of questions from people on Instagram and socials reaching out, just saying, how do I become a nurse? And it's a challenging times, and it's a really challenging role,
and that there's not a set path into it. And because I get that question all the time. And it's like, well, every nurse I sit down has a different journey of how they became a nurse injector.
Exactly.
It's not a clear path.
Yeah, and there's no one right way or wrong way. It's just different as long as, you're safe. And that sometimes is the hard bit, and, what is safe. That sort of, I think there needs to be more from APRA around how the process is going to go so that there's a safety, real safe way, not just for the clients, but for the nurse as well. Yeah. Like you work so hard to get that degree. You want to make sure you're safe.
Exactly.
And you're protected.
Yeah. And maybe some, more steps around what would be required before, going and working for a clinic or starting your own business, and because we're mostly working independently as well.
Yeah, and we all hear the stories of people doing a 2-day course and then starting a business completely independent because they couldn't get a job.
Yes.
Which I completely understand. I understand the desire to do something so much that they set up their own clinic to make it happen. But I often say to people, like, when I did my grad year, I really, really, really wanted to work in Peds ED. I'd done a rotation at the Royal Children's Hospital, which was phenomenal, and I really wanted to work in ED. But I didn't get an ED spot back in the day. So I didn't go and open an emergency department on my own with zero experience.
A pediatric emergency department.
So I think
that's so good.
Yeah, like why do we feel that it's appropriate to, no one will give me a job, so I'm just going to open a clinical job. I'm going to open a clinical environment all by myself and practice independently with no one to mentor me, no one to oversee that I'm doing the right things or not doing the wrong things. So I just think that just because you want something, maybe you need to go about it a different way and get your experience in a different way before you put yourself in an unsafe environment for you and your client, potentially.
100%.
Yeah.
And, potentially because it has been quite glamorized over the last few years, being in injectors, just, dressing up, wearing high heels and sipping lattes and, doing a bit of talks.
Yeah.
But there's actually so much to it. And it's actually really challenging.
Yeah. I don't know whose life is like that when you actually start. Like, I think that's the highlight reel of Instagram, but my life's not like that.
Mine's not. Honestly, you think business life is glamorous? I'm the one like in the trainers, carrying in the rubbish, cleaning the toilet. Like that's my normal day to day.
Yeah. Well, there's that reel, like, what do you do? I do everything. I do the washing, the cleaning, the bins, the accounting, the socials. Yeah, you do everything, right?
All the hats.
Yeah.
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 But that story I was telling you off camera when a patient sort of went elsewhere and then came back and went, oh, there's actually a skill to anti-wrinkle. I was like, wrinkle reduction.
Yes.
I was like, yes, there is.
There is a lot of skill to it.
And that's why you see someone who's experienced at it, right?
Yeah, yeah. And it's not until they experience someone who's not experienced or maybe not great at it that they understand that there is a lot of skill and knowledge behind it.
Like, it obviously hadn't occurred to this, but and I know a lot of people feel that way. You just sort of, you just shove it in, right?
Yeah.
Yeah.
Well, which is another reason why I love education, right? Because the amount of people I come across that have been taught cookie cutter treatments and they don't actually understand the anatomy of why are we doing this? Why would you do it a certain way, not another way? So it's...
And kind of just doing it the same to every patient and wondering why the outcome's not what they were hoping it to be.
Exactly. Why are they not flourishing in their career? Because they're not critically thinking about it and assessing individuals.
Yeah, totally. What advice do you have to new injectors for their training and education when entering the cosmetic industry?
Oh, that's a really tough one. I think that, and I don't want to discourage anyone, but I think maybe thinking about whether now is the right time. I do think that it's a really challenging time. We have a downturned economic climate. We have a lot of changes in the aesthetic industry, and we have a very saturated market. So I just think consider if now's the right time. I'm not saying don't do it, but just consider your timing. I would personally look at one of the more robust courses that are out there, not just the 2-day courses. Ring around, get a little bit more information, find out how much hands-on you get for your money. I know, this is an expensive industry to train in. It's an expensive industry to be in. I certainly paid a lot for my grad cert back in the day with AACDS, and it's even more now. But look at the course content. How much anatomy are you going to get? How much adverse events are you going to get? And what's the hands-on? Do you get to inject a whole face or just half a lip? Which is
good to go.
Which is not great for the client, not great for your learning. And then I would really try very hard to find an environment where you could work in a clinic with other people, whatever that is. If you have to do some voluntary shadowing at your own expense, maybe that's what you have to do. Maybe you take a job that's not your ideal job and you do 6 to 12 months just to get experience. I mean, you got to remember, if you're in the hospital, you're going to be a grad nurse for X amount of time, or you were a grad nurse and you use that time to learn. It's not necessarily your forever job. So I think outside the box, look at dermatology clinics, plastic surgery clinics, look at those types of places and just see if they'll take anyone on 1 day a week, even if you're doing theatres and there's potential for moving into something injecting space.
Even
learn
just be
skin.
Exposed to that, being able to watch someone else and listen to them and listen to their consulting.
Yeah, and just to see what the industry is really like.
Yeah, is it a lot of people get into it and then go, oh, that's actually not for me.
Yeah. And I hear a lot of people are like, it's so hard.
Yeah.
It is. It's not what you see of Instagram. It's working all day and then answering messages, emails, talking patients off the ledge when they're freaking out because their lips are swollen at midnight, and you answer the phone because you're worried that it's a VO and you have to answer the phone.
Can you look at this bruise? And it's in the dark and they've taken this, you know.
Yeah. Or they're like, oh, can I book in for this time? And you're like, I'm on holidays. You know, running a business
I don't
is
care
hard.
about eating lunch. That's fine.
Yeah, exactly. How dare you have lunch? Yeah. So I think maybe get a real insight into what the industry is actually like before you really commit. And I certainly wouldn't quit another job to go full-time straight away. I would do a bit of both, and then I would eventually increase more and more and more days a week in the aesthetic industry as one, your business grows, the client base, your knowledge, your skill, as that grows, and then move into that full time if that's what you want to do.
Definitely.
But be smart about it.
Yeah. And there's no harm in, you know, continuing those other clinical skills. You know, you're saying you do half and half. Nurse Emma, who works for me, she does half and half as well. Yeah. And I think it's really vital that she does have that acute experience and, you know, her knowledge with, you know, adverse events and medications and all of those things.
Because I think a lot of the time nurses think that clinical nursing has no relevance to what we do, but we need to remember that people have a health history. They have medications, they have health conditions, they have vasovagals and they faint. And a vasovagal when they faint can look like a seizure. And you want to have a little bit of experience in dealing with something like that before you freak out.
Exactly.
People might have anaphylaxis. Yeah. Now that's the worst thing that can happen. People are worried about VO. It's not going to kill us. Anaphylaxis might kill us. So having a really solid understanding of those things is important. So I think that it's a good idea to at least do a couple of years of clinical nursing. Plus, if we go into another COVID, it gives us a backup.
Exactly.
You know, if times are tough, it gives you a backup. You can still put food on the table.
Yeah. I've obviously, I don't do acute anymore, but I did do 6 years. Yeah. And then I transitioned really slowly. But even through COVID, I was like saying to my husband, I was like, should I have let that go?
But you could, 6 years is a good solid, you know, basis in nursing. You can go back to that and it will come back to you. It's not like you had zero experience.
Exactly. And just went from like uni to opening up my own cosmetic clinic.
Yeah. And plus it gives you life skills, right? It gives you the capacity to speak to patients and to do two things at once, which us nurses are really good at doing, to get their health history while we're putting in a cannula or whatever we're doing, but to have ask questions about their health and understand what that medication is and what the impact on their body is and what the complication with the aesthetic treatment, the medication we're going to administer, is with their medication or their health condition. Because I've had nurses saying things to me because they haven't understood what the medication means about the health history. Like they might be on a immune suppressant and they have no concept of how that might affect their dermal fillers.
Exactly.
Which is really important.
Yeah. And whether we should be treating those patients.
Yeah.
Totally.
Yeah, definitely.
Good answer. I like it. So I thought you would be a good person to talk to about prescribing options that are available in Australia for independent nurses.
Yeah. I think there's a few now, aren't there? So prescribing platforms.
Yeah.
I think there's two ways that you can go as a registered nurse. So you either get a private doctor or a private nurse practitioner and have your own private prescriber and have a relationship with that person where they prescribe for you and potentially other people. Or you can go through a prescribing platform, I guess, which would be, to name a few. So we've got Fresh, we've got APA, we've got Instant Scripts, we've got Juvet. I think that's all that we have currently in Australia. Oh, there's an anti-aging medicine down in Victoria. They were probably the original ones of this type of prescribing platform. And they are very good because they have access to a wider range of doctors. And I think, you know, I hear a lot of script phone calls, telehealth phone calls during my trainings. Some of the medics that do the scripts are better than others. There's some legalities that goes with telehealth and safe prescribing. And sometimes that's not quite happening. So I would say if you're running a business and it's your own business, it's your livelihood, you need to look at what the legal requirements are around the script, the telehealth call, and what should be done. And if your prescribing platform isn't fulfilling that, that's on you as well.
Yeah.
The APRA aren't going to just sit back and go, oh, well, you pay them money, so they should do it. And if they're not doing it, it's their fault. It's on you as well because you allow that to happen.
Yeah.
These prescribing platforms exist, and they are giving nurses a really great opportunity to run their business effectively, to access better pricing for their products is probably one of the big perks. And then there's after-hours support for your adverse events management, which is excellent.
Yeah.
My one sort of query is like, what happens if you need someone in person? Do they have someone in your local area that can you can take your patient to that person and get them seen face to face? And that's something that I think as the business owner, as the clinician, that you really need to ensure it happens or is possible before you actually start prescribing with them.
Definitely.
Because sometimes VOs happen, and sometimes they're not easy to manage, and sometimes you need other people to help you out.
Yeah, definitely. People with maybe more experience, or, some cases that you hear about, you might need an ultrasound device, you might need hyperbaric oxygen therapy.
Exactly.
Yeah.
Yep. And there's nothing better than a second opinion,
Exactly.
And telehealth is great, but it's limited.
Yeah.
You can see, but it's not the same as seeing in real life. It's not the same as touching, feeling, really actually assessing that tissue in person. I'd find out where the local person is, the person closest to you, if anything went wrong. And if that's not possible, the other thing I'd suggest, build a network. Build a really good network of like-minded people, not just for business, but for clinical, and have people with more experience than you, same sort of experience and maybe less experience, so you have the opportunity to mentor and give back maybe. Building a network would probably be really, really important.
Yeah, definitely. So you're not feeling alone in those moments.
Yeah, exactly.
Especially, like you said, if it's a really tricky complication too.
Yeah.
So do you do private prescribing for other people?
I have a couple of nurses that I do. It's challenging because you have to be available for them when their clients are coming in, and I'm pretty busy doing different things, whether I'm in clinic with my own patients or I'm training and I'm primary healthcare. So I don't do it for very many people.
Yeah, because listening to all the things that you do, like, how would you put that in?
Yeah, it's hard. And if I'm treating my patients, it's a one-on-one relationship. A lot of them I've been seeing for 10 years or so. I know all about them. I know the weddings, the birthdays, the kids, the dogs' names, everything. So they come in and it's all about them. And I don't want to be like, sorry, I've got to answer the phone. I've got to answer the phone.
Yeah.
And then sometimes if if I'm on a day off and I want to run to the shops and the phone rings when I'm at the shops, and that's not a really private professional environment for me to answer a phone. Yeah. So I have a very limited amount of nurses that I do it for that I really trust. And as a nurse practitioner, we are only allowed to prescribe for nurses that we have a mentor type relationship with, that we know and understand their scope of practice.
Great.
So we can say that they are experienced and safe to prescribe to.
Yep.
So I don't know how that works for the medics who prescribe for vast amount of nurses on the prescribing platforms, but that's a rule that the nurse practitioners have to abide.
That's really interesting.
Yeah, but it makes sense, right?
Yeah.
Like if you're in the hospital and you get a medication order, they know that you're capable of doing that.
Yeah.
But if you're on the other side of Australia and I've never met you, how do I know what your scope is?
Yeah, exactly.
So I wonder whether that's an area that APRA are going to look into in the future. I definitely think that is coming around remote prescribing and the bigger prescribing platforms.
Yeah, definitely. Yeah. And having brought some nurses on into my team over the last few years, some of them are no longer in our team and some are, we are with a prescribing platform, my clinic, and I feel like the benchmark for what had to happen for a new nurse to be able to, pick up that iPad and make that telehealth was different every time. So I'm not quite sure if this is something that, they're getting input from APRA and TGA and changing, or whether it's something that they're sort of thinking internally that maybe, okay, how are we going to understand each nurse's scope of practice? because, yes, it has been different every time. There's about 3 or 4 times that I've called up over the last few years, right, I've got a new nurse on board, what do I need? And, as I said, different every time, which is quite interesting.
Yeah, and I think that the prescribing platforms are definitely changing over the years, from inception when the first ones sort of came out. They're definitely getting a lot better at making sure that the nurses are safe, which is always good. And whether it is regulatory or whether it is a business decision, because it's a huge risk these platforms take to prescribe for nurses every day. It's a massive business risk from a litigation perspective of your hard-earned business. And I think sometimes as nurses we forget that they have their own business requirements and they've built up, Fresh have built this amazing business from the ground up, and, it's only right that they protect that. So definitely. I think it's a really good thing. It protects the nurse, it protects your business employing the nurse, it protects your customers, and it protects Fresh. Yeah. So it'll be interesting to see where it goes.
Yeah, especially with the new changes that are coming again. So we'll see.
Yes, definitely. When we were talking about the mentoring, so for new nurses entering this industry, I think seeking someone to do some shadowing with is really important. So we touched on that. But I think if you are that person that wants to shadow someone, respect that person's time and knowledge.
100%.
So the amount of times I get asked for that, and I actually don't offer shadowing because I do education. So
sorry, how many days are in a week? I'm just adding up all the things you do.
I know. And I'm someone who I can't say no to anything. I say yes, and then I go, oh my God, what am I doing? I very much am. But so I also feel that the one-on-one relationship I have with my patients is very important. It's all about them. And when someone shadows you, it takes away from your patient.
It's a different dynamic.
It's a different dynamic, and they're paying me for a service, not to stand here and talk to someone else. So if you find someone who is able to give you a shadowing opportunity, then I think it's only right that they would charge you for that. And, just respect the opportunity of that, because that is
seriously, I love that.
Yeah,
because people they want it for free.
They do, and I understand why they want it for free. But what they need to understand is that we've all spent hundreds of, probably thousands of dollars in our own career to gain this knowledge. To give it away to you for free is not
you with your 20 years of nursing experience.
Well, all of us, you've got so many years, 10 years now in this industry, right?
12,
So
13, I think.
Over a decade, right?
A decade.
That's a lot of knowledge that you didn't just pick up in one training session. It's the cumulation of multiple sessions and taking little bits from everyone and making it your own and making it work for you and your environment.
Everything you've just talked about, you didn't expect any of that for free.
No.
And you took that long path to become a cosmetic nurse.
Yeah. It's interesting when you talk to people and, some people are like, oh, you're so lucky to be doing what you're doing. And I'm sure you get that a lot as well. Yeah. And you think, there's no luck about it. It's hard work. It's taking every opportunity. It's working your butt off, and your days off are spent working on the business generally, or educating yourself or something.
Yeah. So and on that too, I do find a lot. I'll get the messages because I do mentoring as well. And you get the DM and you say, okay, send me an email, and then I send them the email, which also has a price attached to it. Yeah. And then you hear nothing. Yeah. Absolutely nothing.
Yeah. And you've spent some time to put thought into this response to this person, and they can't even say thank you.
Yeah.
It's challenging.
Yeah. And like you said, it definitely changes the dynamic in the room. It changes it from more this, time with your patient, which is sometimes a big catch up. Like I find sometimes, like if we've got a 30-minute tox appointment, 29 minutes of that is pretty much talking, and then I'm like, oh, we better actually do your treatment because you're catching up. But then it changes it to kind of like you're trying to sort of almost train this person, kind of a semi-training session.
Yes.
And it takes away that kind of really personal experience for the patient, because then suddenly you're sort of saying to this other person, okay, so we'll do like the facial assessment now, and it's very different.
Absolutely. Yeah. And years ago I used to work with a doctor, and I would go into the room with her her and her patients, and I had to stand in the corner and not say a word. And I used to think, well, how am I supposed to learn? This is ridiculous. But now in hindsight, looking back, it's exactly that. And I learned a lot by listening to the way she spoke to her patient, the way she would explain things, the way she would talk about facial aging and what was happening to her face. That was the basis of how I now talk to my patients. Yeah. And at the time, I was really ungrateful, thinking, oh, God, I'm not learning. Why do I have to stand here and just be like
silence?
Like it was just, it felt a bit weird, but I learned so much. And now I'm like very grateful to her for giving me that opportunity that I didn't understand at the time.
Totally.
Because I think, as we get older, we gain a lot more insight and a bit more retrospect on things.
Totally.
Yeah.
I love that. Thank you so much for tuning in to episode 23 of this video podcast series. You can find us on YouTube, Spotify, and Apple. A huge thank you to Kelly for joining me today. That was a great chat.
Yeah.
Thank you so much. I feel like I've learned so much about you, and I feel like our listeners can really get a lot of value out of that.
Oh, good. Well, thank you for having me, and I've really enjoyed our chat. I think we have a lot in common and a very, very similar ethos on injecting.
Yeah,
definitely.
Thanks.
Thank you.
Bye.
Bye.
Cut.